Welcome to Ridgeview Medical Center's Introduction to Weight Loss Surgery presentation. We appreciate you being here today and taking time out of your busy day to learn about weight loss surgery. And our goal following this presentation is that we were able to help you decide if weight loss surgery is right for you. Hi, I'm Dr. Jeffrey Baker, and I performed my first weight loss operation over 20 years ago. I became a full-time bariatric surgeon in 2003 when I joined my father in his surgical practice up at Unity Hospital in Fridley, Minnesota. I joined the Ridgeview Medical Center team in November 2017. What I enjoy most about what I do is watching my patients' journey into health. For example, a patient with diabetes will have one of our operations, and the next day their diabetic condition will be gone. As we all know, you should not live another day with diabetes, and it's what I call one of the miracles of our operations. We have 3 different surgical options for weight loss here at Ridgeview: the gastric band, the sleeve gastrectomy, and the Roux-en-Y gastric bypass. All 3 of these operations today are performed laparoscopically. Small incisions, fast recoveries, and low risks for complications. The gastric band, an operation that's been performed in Europe and Australia for over 35 years and has become part of our surgical options since the early 2000s. The sleeve gastrectomy, originally a 2-part operation, but today a standalone operation for weight loss, and this has been since 2008. And the Roux-en-Y gastric bypass, this operation has been around since I've been a surgeon. In fact, I believe my father performed his first Roux-en-Y gastric bypass back in 1973. Our seminar will provide more details about each of these 3 different operations. And when we sit down, we'll answer questions so that you're very comfortable with your surgical choice.
I want to welcome you all to the Ridgeview Bariatric and Weight Loss Center. Our seminar today will give you the tools and the information to be successful. As you know, weight loss is a very difficult thing to achieve, and the center is here to help you. We have exercise physiologists and dietitians, nurses and surgeons who are available to help you get over this illness. Unfortunately, the disease of obesity is partly genetic. And so all of the things you've been told to do may work in other people, but people who have the disease of obesity need full support to be successful. At our weight loss center, we have many patients who have been successful and who are here for very serious reasons. They have diabetes or joint trouble. They may have heartburn or difficulty breathing at night or during the day. And all of these problems are significant and need to be treated in an accredited center. As director of the Ridgeview Bariatrics and Weight Loss Center, I want you to feel welcome and to take full advantage not only of this seminar, but also of our exercise physiologists, our dietitians, our nurses, and our surgeons who are here and willing to help you. If you can do the things that we ask and follow through in our program, it's very likely that you'll be successful, and we do want to help you.
So let's get started. We will cover quite a bit of information today, including a history about Ridgeview Bariatric Center and our team. We'll define obesity and the challenges of obesity, as well what are the causes of obesity. We'll discuss the surgical options for weight loss and give you a broad overview of what to expect following surgery. Finally, we'll go through the steps of how to get to surgery should you decide that this is the right choice for you. Who are we? Well, we are Ridgeview Medical Center's Bariatric and Weight Loss Center. We are accredited as a Centers of Excellence through the ASMBS National Accreditation and Quality Improvement Program. and as of January 1st, 2018, we are accredited as a Blue Center of Distinction with Blue Cross and Blue Shield. Well, what does that really mean for you? Well, it means that you'll receive the highest quality care by a surgeon of excellence at a hospital of excellence. Both meet today and have met in the past bariatric surgical excellence outcomes as set forth by the American College of Surgeons and the American Society for Metabolic and Bariatric Surgery. Our accredited Center of Excellence has an established record and a verified commitment to patient safety. And equally important, most insurance policies today require that bariatric surgery is performed at an accredited center. So rest assured, should you decide to have bariatric surgery at Ridgeview, we will take exceptional care of you. Dr. Jeffrey Baker and Dr. Edmund Chute are Ridgeview's two bariatric surgeons. Both Dr. Baker and Dr. Chute are general surgeons who went on to further specialize in bariatric surgery. And together today they have over 35 years combined bariatric surgical experience. They have performed over 4,000 operations, with complication rates, reoperation rates, and readmission rates significantly lower than the national average. Both Dr. Baker and Dr. Chute work exclusively with the bariatric population, and this is due to their commitment to help you improve your health and quality of life through weight loss surgery. Together, they both work with our specialized multidisciplinary team. We here at Ridgeview understand that weight loss surgery will bring forth both physical and emotional changes, and we have an experienced, highly qualified team that is there to help you every step of the way. We have two bariatric clinic locations. One location is in Chaska and one location is in Fridley. Patients are seen preoperatively and postoperatively at either of these two locations, and all of our bariatric operations are done at our Ridgeview Medical Center in Waconia. So what is obesity? Obesity is classified as a disease by the American Medical Association. Obesity is an illness associated with a number of associated diseases, which we call comorbidities. There is a combination of causes of obesity, so it is considered multifactorial. And obesity is lifelong, it is progressive, it is life-threatening, and it is costly. Weight gain occurs when a patient consumes more calories from food than he or she burns off. Metabolism determines the rate at which your body burns those calories. Metabolism is a complex process that determines your weight and your weight gain. Our metabolism developed in a distant time, a long time ago, when food was much harder to find and daily activities were much more strenuous. We required a very large stomach so that when we encountered food, we can consume most all of that food. And when food was scarce, our bodies adjusted by slowing down our metabolism and going into a hibernation-like state. Today, and especially when dieting, these two principles continually work against us. The 21st century has brought a lot of change with many advancements, but as we see in this slide of an LA fitness club, and what we know today, we no longer need to move to turn off lights or to change a television channel. And obesity continues to increase in epidemic proportions. Today, 68% of adults and 33% of children suffer from being overweight or obese. Obesity is affecting our health, our quality of life, and our healthcare cost bottom line. Annually, over 400,000 people die as a result of obesity and obesity-related comorbidities. It is a serious disease. These maps from 1985 to 2015 represent the continued upward trend of obesity and extreme obesity. And today, obesity is considered an epidemic. So how do we define obesity? Well, we define obesity by body mass index. And body mass index is a calculation of body fat based on height and weight. For example, if you are 100 pounds overweight, your body mass index will likely calculate to equal or greater than 40. This is not a perfect calculation, but what is known is as your BMI increases, your likelihood of developing diseases related to your BMI also increase. So, how do you qualify for surgery? Well, first, let's look at the BMI. If your BMI is between 18.5 and 24.9, you are considered average weight. If your BMI is between 35 to 39.9, you are considered severely obese. And if your BMI is 40 or greater, you are classified as morbidly obese. The term morbid in morbidly obese is used because this degree of excess weight has been shown to considerably reduce life expectancy. So how do you qualify for weight loss surgery? Well, we follow the 1991 NIH indications for qualification, that a patient must be well informed and motivated, should have a BMI equal to or greater than 40, be an acceptable risk for surgery, and failed previous non-surgical weight loss attempts. And if you have a BMI between 35 and 39.9 and an associated serious comorbidity such as severe diabetes, sleep apnea, hypercholesterolemia, or joint disease, you also will qualify. Obesity is linked to so many other diseases, as shown on this chart, and your life expectancy is reduced by 7 to 14 years because of these conditions. We know many of you are here because of these health issues and are ready for a more permanent change to improve your health. So what we know? Well, we know obesity is a disease with serious health risks, and surgery is recognized as a long-term treatment for morbid obesity and can be life-saving, and the health problems associated with obesity typically resolve following weight loss surgery. And as stated in the New England Journal of Medicine, weight loss surgery, together with lifestyle change, is the most effective treatment for significant, long-term sustainable weight loss and weight control for people who are morbidly obese. So what is typical weight loss following surgery? Well, I'm glad you asked. This patient presented to our clinic for an initial surgeon consultation at 395 pounds. She lost 50 pounds prior to a surgery date and went on to lose a total of 210 pounds in total. This is typical of our results at the Ridgeview Bariatric Center. 75% excess weight loss in the first year following the most common operations that we perform. And long-term success? Well, we consider long-term success as maintaining weight loss of greater than 50% of excess weight for longer than 5 years. So what are your surgical options? Ridgeview offers 3 surgical options for weight loss. These surgeries limit the amount of food you can eat at one time and/or changes how you absorb those calories that you do eat. We will go into further discussion of each procedure in the next slides. Let's begin with the adjustable gastric band. In this procedure, the surgeon places a silicone band around the top of the stomach, allowing the creation of a smaller upper stomach. The band is then adjusted by adding fluid through a connected port. On average, patients require between 6 to 8 adjustments before they are eating 3/4 to 1 cup of food, staying full for 3 to 5 hours, and are losing weight at about 1 to 2 pounds per week. On average, a patient will lose about 40% excess weight loss in their first year. There are advantages and disadvantages to the band. The advantages, well, it is a simple operation, and it is reversible, and there are no concerns for malnutrition. But please understand, the true success with the band is within the adjustments. The disadvantages included is mechanical, and because of this it can fail, which would require reoperation. And there is a possibility of the band changing position and causing esophageal inflammation. And finally, should your insurance change, your band adjustments or revisions may not be covered by your new policy. The vertical sleeve gastrectomy. Well, with this procedure, the stomach is reduced and reshaped, and about 80% of the stomach is removed. You still maintain, though, the normal inlet to the stomach and the normal outlet from the stomach. And excess weight loss with the sleeve rivals that of the Roux-en-Y gastric bypass, and on average, a patient will lose about 70% excess weight in their first year. Again, there are advantages and disadvantages. The advantages include The sleeve allows for rapid weight loss and resolution of life-threatening conditions such as diabetes and hypertension. You still have your normal inlet and outlet of the stomach, so foods, liquids, and medications are handled normally. There is no rerouting of the intestines, so you have a lower risk for vitamin deficiency or later bowel complications. The disadvantages include the operation is not reversible, and there might be an increased risk of heartburn or reflux following the operation. The Roux-en-Y gastric bypass. Well, in this procedure, the surgeon divides the stomach to create a new, smaller stomach. The intestine is divided and reattached to that new, smaller stomach. Food then flows from the smaller stomach into the intestine where it is combined with the gastric juices and absorbed much lower down in the digestive system. This allows for less absorption of the calories that you consume. You can expect to lose about 75% excess weight loss in a patient's first year following this operation. Again, there are advantages and disadvantages. Those advantages include it allows for rapid weight loss and resolution of life-threatening conditions such as diabetes and hypertension. The disadvantages include that you have a higher risk for nutritional deficiencies if you are not taking your required vitamins and supplements. And with the rerouting of the intestine, there is a slight risk of future bowel complications. And after having undergone Roux-en-Y gastric bypass, you may develop intolerances to sweets, milk products, or fats. As with any abdominal operation, there is some risk, and we need to inform you of these risks. Please understand, we take many precautions to reduce the possibility that a complication will happen, and you'll be instructed and informed in what to look out for, so that if you have a problem, we can treat that problem right away. We'll keep a close eye on you, and we'll see you back in clinic frequently so that we can monitor your progress and identify any issue immediately. And do understand, here at Ridgeview, our complication rates are significantly less than the national average of all accredited bariatric programs. That said, our surgeons are very thorough to assure that you have a very successful surgery with a very low risk of complication. So, if weight loss surgery is right for you, how do you prepare? First, please check with your insurance company to make sure that you have coverage for bariatric surgery under your plan. If there is coverage, most insurance companies will require that you have a BMI of 40 or greater, or a BMI of 35 to 39.9 with a qualifying comorbid illness. You must undergo a psychological evaluation to ensure that you are emotionally ready for surgery. And you will need to see a dietitian for between 2 to 6 consecutive monthly visits. You will receive an exercise evaluation because we here at Ridgeview understand that movement is critical for your health and your long-term success. And once you come into our program, our insurance specialist will put together a plan specific to your requirements of your insurance carrier. You will consult with one of our surgeons who will review your health history, discuss the different operations, and help you determine the best operation for you. During this visit, pre-operative labs and tests may be ordered, and all of your questions will be addressed and answered. You are welcome to bring in a support person because there is a lot of information that will be covered. As you are preparing for surgery, you will begin taking your supplements and vitamins. Our dietitian will assess your eating habits and the foods you consume. You'll start reading labels and making good food choices to best support your health, and you'll put together an exercise and activity plan. You must be nicotine-free for a minimum of 8 weeks prior to surgery, and we encourage you to reduce or eliminate caffeine and alcohol. And if you've been diagnosed with sleep apnea, we want you to be using your machine when you are sleeping. At the time of your initial visit, your surgeon will also determine a preoperative weight loss goal for you. Why is this? Well, weight loss shrinks the liver and abdominal fat, which allows for more space and mobility for the surgeon during your operation. So losing weight prior to surgery will shorten the surgery minutes, decrease anesthesia time, and allow for a safer operation for you. Let's talk about life after surgery, and what can you expect? How is your life going to change? And what should you be preparing for? Well, expect some discomfort following surgery, and in the hospital, your nurse will be your pain manager. Once home, most patients experience very little pain, and many of our patients have transitioned to plain acetaminophen or Tylenol at that time. And you'll be up walking the same day following your operation, and we encourage that you continue your walking program when home. After surgery, you'll be asked to not use nonsteroidal anti-inflammatory drugs or NSAIDs. Why? Well, these medications increase risk of stomach irritation and/or stomach ulcers. And we ask that you are reading labels to ensure that the pain medication that you are taking does not include NSAIDs. Tylenol or acetaminophen containing products are the pain medications that we recommend. Yeah, of course, you'll want to know, when will you be able to eat and what can you eat? Well, the speed of your diet progression will be determined by your surgeon and your surgical procedure. In the hospital, you'll be given clear liquids, such as juice and broth. And through the course of the next 6 weeks, you will progress to eating your regular diet, but eating less and feeling full on much smaller amounts. And you always will have a fluid intake goal of 64 ounces a day. What about activities? Well, of course, we don't want you driving while taking narcotic pain medication, but we do want you moving. And activities should be taken at your own pace, but with a goal of walking 30 minutes daily. And as far as returning to work, well, most patients return to work anywhere from between 1 to 3 weeks. But prior to going back to work, you'll want to figure out how you'll manage your recovery while at work. What are you going to eat? Do you need a microwave? Is there a refrigerator available? Life after surgery can be an emotional adjustment as much as a physical adjustment, and your leave of absence is an opportunity to really care for yourself. There are guidelines that we know work for long-term success, and these include not drinking before, during, or 30 minutes after your meal. Why? Well, this allows food to sit in your stomach for a longer period of time, allowing you to feel fullness longer. You'll be eating 3 protein-based meals daily without snacking, and you'll be chewing your food thoroughly and eating slowly. You'll learn to stop eating when you're satisfied, but before you are full, and move, move, move. There are nutritional principles that are very important for long-term success. Stay hydrated. Protein is very important following surgery, and you'll want to eat protein-forward meals with a goal of at least 60 grams of protein daily. You'll find yourself asking, is this food worth eating? And you'll be reading labels to ensure that you are getting the best quality food. If you are vomiting, hey, this is not normal. And you must ask, did you eat too much? Did you eat too fast? Or did you not chew your food? These habits are essential following surgery. And taking your recommended vitamins. This is very important for your health following bariatric surgery. You'll be limited in the amount of food that you can eat, so you'll need to take vitamins and supplements daily to remain in good health. And what really does happen to your metabolism following surgery? Well, it significantly increases. You'll be taking in fewer calories, and with exercise, you'll be burning fat and increasing muscle mass. With fat burning and muscle building, your metabolism increases and you burn more calories faster. We cannot stress the importance of lifelong follow-up with your program following your weight loss operation. This truly is a lifetime commitment for you, and it is truly a lifetime commitment for us to ensure that you continue to do well and to stay in good health. Who will you see at these follow-up visits? Well, any or all of the above. But typically, all patients will see their surgeon at their 2-week post-operative visit. If you are a sleeve or a gastric bypass patient, you will see your surgeon and dietitian at 3 and 6 months, and there will be 2 follow-up visits with your exercise physiologist as well. If you're a gastric band patient, you'll continue to follow up with your surgeon for band adjustments every 6 weeks until adequately adjusted. You also will have scheduled visits with your dietitian and your exercise physiologist. And annually, all patients will see their surgeon and dietitian. And remember, we are available outside of your clinic visits to answer any questions and to respond to your concerns. What about pregnancy? Well, pregnancy after surgery is possible, and even more probable following weight loss surgery. I mean, we have so many stories of women being told that they are unable to get pregnant only to become pregnant after weight loss surgery. But we advise women to delay pregnancy for 18 to 24 months following their operation. Why? Well, during this period, you'll be experiencing rapid weight loss with low-calorie intakes. Neither of these are conducive to a very healthy pregnancy. And also, pregnancy might interrupt the post-operative weight loss process, and it might decrease the amount of total weight loss that you can achieve. So talk with our bariatric team in conjunction with your obstetrician about when and how to have a healthy pregnancy. We recommend that you do not consume alcohol following surgery. Alcohol contains empty calories, and the goal following your operation is weight loss. You want to maximize the quality calories you are taking in, and alcohol doesn't provide you with any nutritional benefit. Alcohol might absorb more quickly. It might cause higher blood alcohol levels, and it might take more time to metabolize. You might be more affected by alcohol following your operation, so it is not recommended. Coping. Well, when your relationship to food changes after surgery, sometimes you might look for other ways to cope. And we just want you to be aware that this might happen. So if you feel as though you are struggling emotionally, we'll help you connect with support, some programs or mental health providers, because we know there is a strong emotional component to weight loss that is very important to recall. This is a journey into health, and this new life is exciting, but it also can be a big change. Support groups. Well, research shows that bariatric patients who participate in support groups lose more weight and maintain weight loss for longer periods of time. How can you find a support group? Well, we have 2 monthly meetings in Chaska. They're meetings with open forums and interesting topics. So why choose Ridgeview Bariatric Center for Weight Loss Surgery? Well, again, Ridgeview is an accredited National Center of Excellence. And this acknowledges that our surgical practice and our comprehensive program both are committed to outstanding patient care with excellent outcomes. And our surgeons, Dr. Baker and Dr. Chute, are highly specialized with over 35 years of experience. And our comprehensive medical team at Ridgeview is committed to making this journey a successful, life-changing journey for you. We understand that you may not be able to continue to see your original bariatric center following surgery. So if you're an individual who's seeking a possible transfer of care, please contact our care specialist and she or he will assist you in this process. And again, Ridgeview Medical Center is accredited as a Centers of Excellence and all insurances are accepted. Thank you.